What antidepressants are you on? How did you know you wanted to be a doctor rather than a PA? Tips for long distance. Hey y'all, welcome back to my channel and welcome to my first ever Q&A. I posted an Instagram story for y'all to ask me anything and I got dozens of responses. If you're not already following me on Instagram, it will be linked below. It took me getting to 100,000 followers on Instagram to believe that people care about a Q&A from me, so this is exciting. A quick blurb about where I am in my life for these questions to make sense. I am currently a radiology resident physician. I went to medical school and I'm currently training in Texas. I got married a couple years ago. We did couples match to residency, but it just turned out that my husband and I are spending the first 4 years of our marriage long distance between Texas and New York. Yeah, first 4 years, super long distance marriage. I feel like that's the most relevant stuff right now, so let's just get into the questions. The most common question I got was, why radiology? Why did I choose that as my medical specialty? And how do I want to talk about this? I'll first say why, and then I'll say when, and then I'll say how much. So why? My top reason for choosing radiology is because I find it so fun. I've actually wanted to do radiology for a really long time, which I'll get into soon. I guess I should quickly mention what is radiology for some people who don't know. So radiologist is a physician who reads imaging, just very broadly. So any x-rays, CT scans, MRIs are the things that most people think of, but we also read a lot of other stuff like nuclear medicine studies. It also includes interventional radiology, which are a lot of vascular procedures. It also includes mammography and all of the procedures that go with that, like every single breast biopsy for any suspicion of cancer. So that's what radiology is. Okay, my battery already died. That was weird. You truly need to know internal medicine, post-surgical changes, OBGYN, pediatrics. You really have to be familiar with all of it, and that's something I really like. What keeps a lot of people from going into radiology is the idea of not seeing patients and treating patients, and kind of the idea of what a doctor does. And when I'm rotating through mammography, interventional radiology, nuclear medicine, we do clinic visits. We do see patients. Granted, it's not as consistent as every single rotation as if when I was an internal medicine intern. But just the fact that even on those rotations where I'm mostly just looking at images and interpreting images, I know that I participate in dozens of patients' care a day. Next, for when did I decide to go into radiology? I actually have been wanting to do this since I was 18 years old, and most people don't even consider or are not aware of radiology until their third year of medical school, which is usually around 23 years old or so. But I was in a college honor society, and at one of our lunch meetings we had a radiologist come and just show us some cases and kind of tell us what he did, and I had never seen anything like that before in my life, and I was starry-eyed. I was like, what is this? This is so interesting, so fun. But of course, through college pre-med and through medical school and rotating through all the different specialties, I kept an open mind, but really nothing touched this field for me. I truly love my job. Oh, Tony came to say hi. Hi, Tony. Oh. In one of the question stickers someone sent me, they asked what is the gender proportion in radiology, and it's roughly 25% women in practicing radiologists, so that's after residency and they're attendings now, and it's also roughly 25% in resident physicians. So this is actually a specialty where over time the gender makeup has not really changed. I want it to be more women, so if you have any questions about that, you can ask me, leave them in the comments, message me on Instagram, whatever. Oh, someone said, what's the most interesting specialty so far among radiology? So body, MSK, neuro, interventional radiology, women's, pediatrics, and it's neuroradiology. It is. That's always been my passion. I've always liked all things neuro. I even majored in neuroscience back in college and stuff. Ooh, the next question is juicy. What antidepressants are you on, and when did you start them? Do they help? All right, so in medical school, third year of medical school was maybe the second lowest point in my life, but my lowest point was real low. I nearly died, and I almost nearly died in medical school too. So whatever, I'm not gonna get into the whole story because that will be too long, but one day at the hospital, I had this breakdown. I was uncontrollably sobbing for 2 hours and I couldn't get myself to stop. So I called my school clinic. I was crying, and I told them hey, I really need to see someone. And they were oh, are you planning on hurting yourself or hurting anyone else? And so I left work that day. I didn't want to, but my other med students with me on that rotation were like, Sally, please, like, go home. I got saw by a psychiatrist for the first time, which I should have been seen by a psychiatrist way before that. And I started antidepressants, and the antidepressant he picked for me was bupropion because SSRIs are typically first line, you know, your typical things like Lexapro, but he said that he didn't think it was very safe for me to wait the 4 weeks for SSRIs to take effect. I will say a couple like huge caveats for bupropion. Don't choose bupropion if you have anxiety because it makes anxiety a lot worse. Luckily, I did not have generalized anxiety in addition to depression at that time. And also do not take bupropion if you've ever had seizures. So obviously this is not real medical advice. Ask your own physician who's prescribing you these things to help you decide which is the best step. But yeah, so I started bupropion in third year medical school. I stopped it in the middle of intern year because a lot of my stressors, like my unrelated other stressors, kind of subsided a bit. So I was on it for 2.5 years, and I really, really recommend trying out medication. It's just like treating hypothyroidism or just like treating horrendous period symptoms, like any other medical condition that can affect your mood. It's my own soapbox, but yes, highly recommend. Oh my gosh, this is a question I laughed out loud when I read it. Okay, it's, do you think you have to have a pre-existing passion for the med field, or does it grow on you? And the reason I laughed out loud when I read this question is because it does not grow on you. You, like 1,000,000%, one with 6 zeros after it, have to have a pre-existing passion. Yeah, it does not grow on you. You need to have a pre-existing passion. I know so many people from medical school who, of course, we're all passionate when we go into medical school, and you're just so worn down by the end of the years of education, by the end of the up to 7 years of residency and fellowship after that. A lot of people just don't retain that passion anymore. So yeah. Granted, most of the physicians that I'm close with are resident physicians, kind of around my same age group and same life stage, but almost all of us are not going to encourage our kids to go into medicine. You can have passion and it does get better eventually, but you need to get through a lot, and some people you would never expect to end their life early choose to. Everyone gets broken down, and it sucks. I'm not trying to downplay it. Yeah, that's my answer. My second most asked question is essentially tips for long distance, because I am in not just a long distance relationship, I'm in a long distance marriage. So bummer. What are some tips for long distance couples for the long term, 4+ years? Any dates or activities to feel closer to your partner when you're long distance? How often do you and your husband chat or video chat when we're long distance? How do you manage long distance with your husband? Unfortunately, the medical field ends up splitting up a lot of couples because, like, physically splitting up, and actually like breakups, but we'll talk about physically splitting up for now, just because you don't really get like much of a choice for where you spend a lot of your years. Because in med school, you're just happy to get into med school. And then in residency, you're just happy to get into residency. Wherever that is wherever it is. So I'm gonna say 3 things that my husband and I do. One thing we do is watch TV shows or movies, like we watch some kind of TV over dinner, over FaceTime. Just spend time together in a really easy way that doesn't occupy a lot of extra time. But you're gonna be eating dinner anyway, so you might as well watch something together. My second tip is to always know when you're gonna see each other next. Even if it's 2 months away, it doesn't feel as like hopeless. You don't sink into despair when you just have no idea when you're gonna be able to see them next. And my third tip is to call at the end of the night, even if it's like a 3-minute call just to say goodnight. We do that every night that we can. Sometimes when I'm like working nights, obviously we won't do that. Or if he's on call or whatever, pretty much every night to say goodnight and to debrief about your day. And kind of there are things that might frustrate you through the day, but you don't want to complain to other people about. That's what your significant other is for. One question I got, which is a great question: how did you know you wanted to be a doctor rather than a PA? And I'm gonna be real, at the time that I was applying to med school so many years ago, I I wasn't really that aware of PAs. I never really looked into the process of applying to a PA school because I knew I wanted to do radiology. So my answer is really easy because kind of to go into some of these specialized paths, especially radiology, it has to be medical school. So, but I know that for like maybe some more primary care specialties or some other like clinic specialties, PAs can also specialize and work in those specialized places, but it just wasn't my journey. Oh my gosh, my battery is like dying again. What is going on? So I'm gonna wrap up my video here. I know there were so many questions. DM me comments. I will answer the comments. Any questions, I will answer DMs. Thank you so much for spending your time with me. I hope you have a wonderful rest of your day. Remember that y'all are my treasure. Woo! Find the beauty in every day, but most importantly, be kind to yourselves. I'll see y'all in my next one. Bye.